Hello, and welcome back to another episode of the Soft Tissue OT podcast. My name is Jordan, the Soft Tissue OT, and today we're diving into a condition that's incredibly common but often misunderstood, and that is shoulder bursitis. Now, if you or someone you know has dealt with shoulder pain, you've probably heard this term before. But here's the thing. Most people struggle with shoulder bursitis because they're not getting to the root cause of the problem. The way we like to frame it up is that shoulder bursitis is actually a secondary issue, meaning something else is causing irritation to the shoulder or aggravating that bursa and causing that bursa to become inflamed and obviously painful. So treating bursitis alone without identifying and fixing the root cause is why it keeps coming back for so many people. So let's get into the details of why this is happening and how you can fix it for good. So firstly, to understand shoulder bursitis, we need to first look at the anatomy of the shoulder. The shoulder is an incredibly complex joint and allows us great range of motion and most movable joint in the body. But with this, it also makes it prone to injury. Now, the main joint we're talking about when referring to the shoulder is what we call the glenohumeral joint, which is the ball and socket joint where the head of the humerus, which is the upper arm bone, sits in that shallow socket of the shoulder blade, and that's what creates that ball and socket type of joint. There's also the AC joint, which is the acromioclavicular joint, and the subacromial space, which sits just underneath that acromion, hence the name subacromial space. And this is most commonly where shoulder bursa issues can occur. Now, don't forget as well, the shoulder's also got another joint at the back, which is where your scapula meets with your thoracic rib cage, for example, and that's where we call it the scapulothoracic joint as well. So it's a floating joint, and that's why it's often forgotten, but it's very important as well. Now, between the bones and the soft tissue of your shoulder and other joints as well, but specifically what I was talking about the shoulder today, there are bursas, which are small fluid-filled sacs, and their job is to reduce friction and basically cushion pressure points in the joint, right? So in the shoulder, the most important one is the subacromial bursa. As we said before, that lies underneath the acromion, that subacromial space, and it's located between the rotator cuff tendons and the acromion itself, the bony part at the top of the shoulder. And that's what you can actually feel if you sort of palpate on the top of your shoulder and you feel that bony sort of projection there. That's the acromion, and the subacromial space obviously lies underneath there, and the subacromial bursa lies in that space as well. So what does the rotator cuff do in all of this? Well, the rotator cuff, we often refer to them as the king of the shoulder. The rotator cuff is made up of four muscles, which are the supraspinatus. They sit on top of the scapula or spine of the scapula. Spinatus, which sits below the spine of the scapula. The teres minor, which sits laterally on the outside, and then the subscapularis, which sits in between which sits beneath the scapula and in between the rib cage. Now, these muscles work together to stabilize the shoulder and obviously allow more efficient movement. They keep the head of the humerus firmly within the socket during movements and preventing it from moving excessively and causing issues and basically dysfunction of that shoulder. They do also do a little bit, if you look at some of the textbooks, they do a little bit of movement as well, but that's more of a secondary job that they do. Their main job is to stabilize that shoulder through its various planes of motion that we put it through. So how do you know if you have shoulder bursitis? The most common signs and symptoms include pain and tenderness, obviously around the shoulder, particularly when you lift your arm up, out to the side or out in front of you. And that's because that bursa, which can get inflamed and swell up, gets compressed underneath that subacromial space. You have limited range of motion. Some patients can't, lift their arm up above their shoulder height or even less than that. And your shoulder might feel stiff or weak as well. There can sometimes also be some swelling or warmth around the joint as well. And a lot of our patients also describe that it's painful to lie on that side. So if you're sleeping at night, lying on that shoulder, compressing that joint and compressing that bursa a bit more, that can be painful. So that's a common sign that patients often say they can't lie on that affected side. And often patients describe an achy pain, but it can become sharp when reaching or lifting. So who's this most common in? Well, athletes who perform repetitive overhead movements like swimmers, javelin throwers, baseball players, even cricketers that are throwing a lot as well. Then you also got middle-aged adults and the older individuals, particularly those with, have lost some control and strength and some issues going on with the muscle strength and the muscle volume as a whole. And then also people with certain occupations. So those are repetitively using their arm, particularly going up and out to the side. So we're looking at things like painters or carpenters, those who constantly use their shoulders for overhead work. But here's a kicker. This isn't usually the primary issue, right? So something is causing the bursa to become irritated. So again, these are where we see it more often in, and it's a secondary issue. So we need to figure out how to stop the pain for good by actually identifying that root cause. So getting to the root cause and treating shoulder bursitis. Let's talk about the treatment. Like I said before, the real problem isn't the bursa itself. It's what's causing the stress and aggravation of the bursa in the first place. Now, one of the key factors that can contribute to this is rotator cuff dysfunction. So things like rotator cuff tears or weakness in the rotator cuff. If the rotator cuff itself isn't working properly, it can't keep the head of the humerus in the right position and stabilize that joint and allow you to move efficiently. And that can lead to aggravation on those structures in the shoulder, such as shoulder cartilage itself, the tendons, or even the bursa can become aggravated. And that's where we can see often what we call impingement signs, which is where the underneath the subacromial space, those structures that are involved in there can often start to be impinged upon. Now, rotator cuff stability is crucial, right? So we need to strengthen up those four muscles that we mentioned earlier, ensuring that they are doing their job correctly and able to hold everything in the place where it should be and stabilize that shoulder joint efficiently. Then another issue can be the scapulohumeral rhythm. So back to what we're talking about with the other joint that often forgotten by a lot of people is that scapula and the back of the rib cage. Now, your scapulohumeral rhythm talks about the scapula and the humerus arm bone actually moving independently but together, right? So, for example, when you're lifting your arm out to your side, your scapula should actually rotate in an upward rotation is what we call it, and that will create more space at the top of the shoulder for that humerus to move into without pressing or impinging on those underlying structures. And then finally, one often overlooked factor is humeral depression, basically keeping the humeral head down and away from the bursa. Now, this is where the muscles like the latissimus dorsi, the lats, teres major, and the pec major come into play. These muscles are responsible for creating humeral depression, so pulling the head down of the humerus, pulling it downwards. And that allows more space in that subacromial space, which is, again, where your bursa and other important structures sit. So when we target these muscles through specific strengthening exercises and specific movements, we can reduce the pressure on that subacromial bursa by creating more space. A study in the Journal of Shoulder and Elbow Surgery highlighted the importance of these muscles in maintaining shoulder mechanics, right? So working on and strengthening and activating the lats and the teres major, we can significantly reduce the likelihood of impingement type of issues and therefore things like bursitis as well. So treatment itself is really twofold, right? We've got to strengthen the rotator cuff to stabilize that shoulder. And then we've also got to strengthen the humeral depressors to ensure that head of the humerus stays where it is and is protected and not, undue stress put on it when we're moving around. So exercises like, for example, single arm lat row, external rotations, or what we call the armpit squeeze, which are, if you want to take a visual look, we've done some videos that are on our socials and YouTube as well, so you can go check those out. But specific movements that when we target those muscles in an adduction, which is adding towards the middle of the body, when we do movements that with involving the lats, the teres major and the pecs, in that movement of adduction, that's where we really get the greatest amount of humeral depression. So we really like to start with those to create some more space for that bursa. So again, go check those out on our social media on YouTube. And it's important to understand, again, addressing the root cause, right? The dysfunctional cause as well. And one point I want to highlight while we're talking about humeral depressors is the fact that, again, if we're using our arms up out to the side or out in front of us, some of the muscles can do humeral elevation, right, which is where they pull the humerus up in that socket. And so if you think about our day-to-day stuff, we very rarely are grabbing something from up above and then pulling down with a great amount of force. It's normally lifting things up, right? So you're lifting a box, carrying up. Painters are lifting their arm up, obviously doing the painting. Carpenters, again, lifting their arm up, holding a piece of wood or electric tool. So if we're doing a lot of those movements that create a lot of humeral elevation, that's again going to reduce that space, cause more pressure on the structures underneath the subacromial or in that subacromial space, like the tendons, cartilage, and also bursa. So again, understanding the root cause, right? Okay, so in summary, the key points to take away from today's episode is that shoulder bursitis is a secondary issue. It's a symptom, not the root cause. Something else is causing stress on the bursa, and you need to identify and treat the root cause, and you actually get rid of the symptom. Now, part of that, the rotator cuff is crucial for shoulder stability, and weakness or dysfunction in the rotator cuff can lead to issues like impingement or impingement movement and humeral elevation, which again can aggravate the bursa. Therefore, we like to include the humeral depression, right? So humeral depression is vital to relieving pressure and creating more space underneath that acromion. And this is where muscles like the lats, the teres major, and the pec play an essential role in this. So if you're focusing on strengthening these areas, not only will you relieve your shoulder pain, but you'll also prevent it from coming back, or the likelihood of it coming back. So if you've been dealing with shoulder issues and struggling with shoulder bursitis and just can't seem to get rid of it, don't wait any longer. Come to us at Perth Injury and Pain Clinic, or even message us or get in contact with us, and we'll actually help you identify that root cause of your shoulder issues, provide the personalized treatment that you require, whether it be, like we're saying, the humeral elevation, rotator cuff instability, or whatever else is causing that issue. We're actually going to identify the root issue, treat that, and then we'll get rid of bursitis once and for all. So, as always, thank you very much for listening. Keep healthy, keep doing what you love. But as always, thanks very much for listening. Keep learning, keep healthy, and keep doing what you love.